Good morning. This is EXS 471, and today we are discussing what should be, once again, being a health professional and really what it takes to be a health professional. And I would also say, I want to hear from you guys, in your opinion, what does it mean to be a health professional? All right. We only have a handful of slides, and these slides are redundant. You've gotten these slides if you've had me for EXS 470 during the pre-internship, but I wanted to reintroduce them at the beginning of your internship because guess what? Now as you've started your internship, you actually are the health professional. So I want to kind of remind you guys what I believe to be and what your textbook believes to be a health professional, and kind of restart the conversation. All right. So if you remember, and I'm not going to go over these too extensively, these were the 5 attributes as outlined by one of your texts from EXS 470 of a health professional, right? This is what differentiates a physical therapist, a medical doctor, an athletic trainer, right, from someone like a cashier or a manager. And, to be clear, once again, I am not speaking down about those other careers, but there is a difference between those careers, right? And the first one is that we master skills grounded in theory, and we've got to remember that we've learned a lot of information during your 4 to 5 years as an undergraduate student, and a lot of your decisions should come back to all of those theoretical underpinnings that you have learned. Two is you perform services for clients. And I would argue a lot of what this discussion is about and the discussion board assignment is about is probably really harping on points 2 through 5 here, right? You perform services for clients. And one aspect of that really should be you want to remove service dependence for your clients. That should be a goal of yours, right? And the example is, the example that we actually talked about most recently in a different class is, okay, you have a chiropractor and, your chiropractor basically says, come see me twice a week. And there's no real end goal in sight. You go see a chiropractor twice a week for 3 months, 6 months, 8 months. And this isn't to attack chiropractors, but, if there's no real targeting of the underlying issue, right, we're really just creating this dependence upon the chiropractor. Okay. Granted monopoly status by the community. No one else other than people in your field can do what you do, right? 4 is guided by ethics, and we'll talk a little bit about that on the next slide. And then 5 is meeting expectations and standards of the subculture. Hopefully you guys remember that discussion from EXS 471 or 470. Oftentimes you're going to be asked to go above and beyond, and I don't think that should be a daunting task, right? It's part of what it is to be a health professional, to work extra hours, to go the extra mile, to perform services for clients. So this is where I wanted you guys to think. I think in 470 we kind of went over this one line in the slides, and that's why I wanted to talk a little bit more about it, right? Values shape conduct, right? Values shape conduct. So really, what does that mean, right? I mean, the first and foremost, you have to figure out what are your core values as a human being, right? And not all of us have the same values, right? I am not asking everyone to be a perfect human being because we are all not. But I believe that if you have a strong set of core values, right, you're going to be really, guided by those ethics. You're going to follow those ethics. You're going to act in an ethical manner, right? So the first thing is what are my core values as an individual? And I would even argue that those core values can change over time, right? My core values as an 18, 19, 20-year-old are very different than my core values today as a 38-year-old man, right? So I also put in this quote here, right? So just kind of using myself as an example, right? When I'm working with some of my athletes, like what I typically tell them is a goal of mine is to develop a young person of character. And I would argue it's very similar within the classroom setting. Develop young persons of character, right? And what is character, right? It's having those virtuous core values, being in some ways altruistic, always looking for the good in people and trying to do good for other people as well, right? So, kind of giving you guys some examples of what high character value is. I'm trying to think, like, if you have a client, right, that unfortunately they have a very busy schedule and they can only meet you, after your official closing hours, right? And sure, maybe this might be more private practice versus a larger like clinical institution, but maybe you say, okay, on this day I'll come in late for you, or on this day I will come in early for you, because you can see that this treatment is incredibly important for this person to get better, right? I think that's what character is, going above and beyond. Maybe this isn't character, but having core values of an extreme work ethic to help people. Maybe you don't know about a given topic, so you spend hours over the weekend researching a given injury so you can better equip yourself to help a future or incoming patient. Those are just two quick examples of someone that has strong, positive core values and really strong character in general. So, as you're answering the discussion board questions which are coming up, really think about those core values you currently have, and maybe potentially like things that you can improve, right? So these are your discussion board questions. They're already posted on Blackboard. I want to ask, what does being a health professional mean to you? And I don't want to give my like full-fledged answer, because I want you guys to share what it means for you, right? And really, take a minute or two to reflect on that, right? Can you provide an example where you noticed a lack of professionalism in a health setting? I mean, I can give you guys many settings or many examples, right? Lack of professionalism. I've given you guys examples of when I was an assistant coach, a head coach, really just outing an athlete in a very low character way, right? The way you go about things can really set the tone. And what I'm basically saying is, he called this one athlete out in front of the entire team, and it really did not warrant or call for that. And he spoke about him in front of the entire team in a negative light, right? Can I give you an example of a physical therapist? Yeah, sure. I think just speaking in general, we've talked about this in class, right? A lack of professionalism could be like physical therapists, routinely showing up 15 minutes late for work because they think their aides can handle the initial, I don't know, not assessment, but organizing and the initial warm up for clients. First of all, that is illegal. Aides need to have a physical therapist on the floor. And second of all, that's your job, is to really be there to facilitate, to guide the aides, and then obviously to work with the patients, right? So those are just a few examples, and I want you guys to give me your examples. I'm sure we've had them, right? Third one is, what is an area of professionalism you think you can focus on this semester during your internship and you want to improve, right? So think about professionalism in general and how can you improve things. I'll speak to you guys about, my level of professionalism as a professor, right? I spent quite a bit of time at the end of the semester reviewing the student evaluations that all of you provided for me. And, while I'm pretty happy because I think most of the responses were very, very positive, there was a handful of students who gave some feedback that was not positive. And that's fine. Of course, I wish it was all positive. But what I did was I basically took some of the feedback, and I think one area in which probably two students mentioned was organization of the syllabi. right? So like what I tried to do is I tried to clean things up a little bit and make things much clearer. And I spent quite a bit of time during winter break looking at the syllabi and how I can make things a little easier for students to understand. And then beyond that, I spend a little bit more time highlighting the very important parts at the beginning of each class. So that's an example of like professionalism, I think, communication that I tried to improve. So really think about yourself, think about things that, maybe those, whether it's a core value, whether it's a quality where you're consistently late for work. Okay, I really think I can be on time, or whatever it is, right? Think about something, because like I said, none of us are perfect, and what's something we want to work on to really improve during this internship. All right. That's it. As you guys know, these are meant to be short, and it's supposed to be a conversation, and that's what the discussion board serves as.